Good afternoon. My name is Jill. I'm a master's in nursing student at Cedar Crest College.
Good afternoon.
Thank you for volunteering to do this health history assignment with me. I appreciate it.
My pleasure.
Mr. Larkin, how would you like me to address you?
Call me Fran.
Okay, Fran, great. All right, so we're going to get started by verifying some biographical information. What's your date of birth?
5/10/45.
Okay. And you're male, Caucasian,
Irish American.
Irish American. Okay. Do you have health insurance?
Yes.
Do you know what health insurance you have?
I have Medicare and AARP supplemental.
Excellent. Okay. And what brought you here today?
I was asked to do this survey.
Okay. Thank you again for participating.
You're welcome.
Do you have anything you'd like to share about your general state of health? Do you consider yourself healthy?
It's fair.
Fair. I'm going to ask you about some childhood illnesses.
Mm-hmm.
Do you recall ever having measles, mumps, rubella?
Well, some of them, yeah.
Okay. Do you know which ones?
I would say measles and chickenpox.
Okay. Ever have whooping cough?
No.
Rheumatic fever?
No.
Scarlet fever?
No.
Polio?
No.
Okay, so measles and chickenpox.
Yes.
Do you know when you had those approximately?
Probably between the ages of 5 and 15.
Okay. How about any chronic illnesses that you have now?
Right now I have hemochromatosis, cirrhosis of the liver, arthritis, and diabetes.
Okay. Do you have any injuries right now that you're dealing with, that you're getting treated for?
No.
How about hospitalizations? Have you been hospitalized recently?
No.
No. How about surgeries? What surgeries have you had?
I've had bilateral knee replacement.
Okay. When was that?
Again, I'm going to guess and say about 8 years ago.
Okay. And any other surgeries that you recall?
No.
Okay.
Okay, back that up. I did have lung surgery.
You had lung surgery. And when was that?
That was approximately 4 years ago.
Okay. And what kind of lung surgery did you have?
I had a collapsed lung.
Oh, you had a collapsed lung. You needed surgery. Okay. And then any active problems, anything today that's really bothering you that you want to mention?
No.
Okay. I'm going to ask next about allergies. Do you have any allergies to medications?
No.
Any allergies to foods or drinks?
No.
Any seasonal allergies, hay fever?
No.
Okay. Substance abuse. Did you ever smoke cigarettes?
No.
How about alcohol use?
No.
Any recreational drug use?
No.
Cocaine, marijuana?
No.
No. Do you exercise?
I dog walk.
Oh, how much dog walking do you do?
1-2 miles a day.
Okay. Do you do that every day?
I try to, yes.
Okay.
Weather permitting.
Do you follow a special diet?
No.
No. How about sleep patterns? Do you have a regular sleep schedule?
Yes.
Yes. Okay. Any trouble sleeping?
No.
Okay. Do you know what medications? Do you take any medications currently?
Yes.
Okay. Oh, did you bring a med list?
Yes.
Great. What medications? Do you mind reading them for me?
I take 81 milligrams of aspirin daily. I take insulin glargine 21 units daily. And I take Januvia 100 milligrams daily.
Great. Any vitamins or supplements?
I take a multivitamin.
Okay. Anything else?
No.
Any herbal medicines? How about any medicines that you've taken in the past that you've discontinued that you could think of?
No.
No. Any allergies to any medicines?
No.
No. How about immunizations? Do you get a flu vaccine?
I get a flu vaccine, and I've had the pneumonia vaccine.
Okay.
And I had the first shingles shot.
Oh, okay.
Vaccine.
Great. So do you get the flu vaccine every year?
Yes.
Okay. And you're up to date on your pneumonia vaccine?
Yes.
Okay. And you had the first shingles. Great. How about prostate exams? Do you get those regularly?
Yes.
Okay. Eye exams?
Yes.
Do you see an eye doctor?
Yearly.
Yearly. Dental?
I have dentures.
Okay. Uppers and lowers?
Yes.
Full set?
Yes.
Okay. Do you do self-exams, breast or testicular exams?
No.
How about do you wear a seatbelt when you drive?
Yes.
Do you ride a bike or a motorcycle? No. Okay. How about do you use sunscreen when you're outdoors?
Yes.
Okay. Is there anything in your life that you're trying to change? Any lifestyle modifications?
My diet.
Your diet. What are you doing with
Trying
your diet?
to go towards a more diabetic leaning diet.
Okay. Alrighty. Do you work? Do you still work?
I'm retired.
You're retired. And what kind of work did you do?
On construction.
Okay. So did you work on construction sites?
Yes.
Okay. Were you employed full time?
Yes.
Any exposure to hazardous materials or noise when you were working?
No.
No. Any symptoms from your work-related injuries?
No.
How about hobbies? What hobbies do you have?
I walk dogs.
Walk dogs? Great. How about travel history? Recent travel?
No.
Have you
Recent
been out
travel.
of the country?
No.
So I'm going to ask a little bit about your family history.
Mm-hmm.
How about your parents? Did any of your parents have heart disease?
Yes.
How about diabetes? Your parents?
No.
High blood pressure?
No.
Cancer?
No.
Strokes?
No.
Genetic diseases?
No.
Okay, so both of your parents had heart disease?
Yes.
How about, do you have siblings?
Yes.
Do you know if any of your siblings had heart disease
No.
or have heart disease?
No.
Are your siblings alive?
Yes.
Okay. Any of your siblings with high blood pressure?
No. Not that I know of.
Diabetes?
No.
Cancer?
No.
No. How about high cholesterol?
No.
Stroke?
No.
Genetic diseases?
No.
How about mental health stuff?
Fine.
No, none of that you know of with your siblings
No.
or your parents. I forgot to ask.
No.
Your parents. No. Okay. And then how about your children? Do you have children?
Yes.
Do you know if any of your children with heart disease?
My two sons.
Your two sons with heart disease. Any other diseases among your children? High blood pressure, diabetes, cancer,
No.
Stroke,
No.
mental health, genetic diseases?
No.
Okay. All right. So 2 children with heart disease, and both of your parents deceased from heart disease. Okay. How about I'm going to ask you a little bit about your life. Any religious practices?
No.
Prayer, meditation? No. Marital status? Are you married?
No.
Are you divorced or
Yes.
widowed? Divorced?
Divorce.
Okay. Do you live alone?
Yes.
Okay. Do you have a support network?
Yes.
Friends, families?
Family and friends.
Okay. Is there anything you want to share about yourself? Your upbringing? No. Were you raised in Pennsylvania?
Yes.
Okay. Any thing you'd like to share about like perceptions of your health care? Do you have a feeling about your health care?
I'm satisfied with my health.
You're satisfied? Okay. How about your life? Are you satisfied with your life?
Yeah.
Yeah. How has illness impacted your life?
Slowed me down.
Slowed you down? Okay. Okay, I have to ask about your sexual history, okay? So just a few questions. Do you have any comments about your sex drive as an indicator of your health?
No.
Are you sexually active?
No.
No. Are your age of your first sexual experience?
I'd say 15 years old.
Okay. Any sexual problems that you've experienced?
No.
How about any history of sexually transmitted diseases?
No.
Any risky behaviors?
No.
Do you have a sexual orientation that you identify with?
No.
No. Are you straight or
Straight.
gay or bisexual? Straight. Okay. Any history of sexual abuse or rape?
No.
No. Okay. The last part of this is a review of systems. Okay, so I'm just going to ask you some general questions, head to toe, and then anything that you say yes to, I might ask you some more questions. Okay. So first is just general. Any recent weight loss or weight gain?
A little bit of weight gain.
A little bit of weight gain. About how much?
I'd say roughly 10 pounds.
In the last
year?
Okay. Do you weigh yourself?
Occasionally.
Occasionally. So you have a scale at home?
Yes.
Okay. Any fevers recently? No. Okay. How about your eyes? Any recent vision loss?
No.
Eye trauma, eye pain?
No.
Discharge from your eyes? No. You do wear glasses?
Yes.
Are they for reading or do you wear them all the time?
Both.
Both. Okay.
They're bifocals.
Okay. How about your skin? Any skin lesions, moles, rashes?
I have dry skin and rashes.
Okay. And where are they?
Mostly my legs and arms.
Okay. And when did that start?
Years ago.
Years ago. And is that all the time or is it only in the cold weather? All the time. Do you have open areas?
No.
Is it like dry, scaly skin?
Yes.
Or is it raised at all, or is it flat? Okay. What helps these rashes?
I use a lotion.
Use a lotion. Is that over the counter or
Yes.
prescription? Over the counter. Do you know what it's called?
No.
Okay.
I can't think of it. No.
That's fine. Do these rashes spread anywhere? They're
No.
localized to your arms and legs.
Yeah. Yes.
Okay. And you said it's just kind of a general thing. It's not seasonal or anything. It's all year long.
Yeah.
Okay. And do these impact your life? Are they painful? Do they
No.
stop you from doing things?
No.
Okay. How about lymph nodes? Any enlarged or painful lymph nodes?
No.
Okay. Any problems with your bones, joints, and muscles?
Just
fractures, pain, stiffness, weakness, atrophy?
stiffness and weakness from the arthritis.
Okay. Does that affect all your joints, or
Yes.
is it
Yes.
everyone, head
Yes.
to toe, basically? Neck, shoulders, arm? Okay. All right. What helps the symptoms of stiffness and joint pain?
I take hydrocodone for the pain
Oh, okay.
as needed.
As needed. Do you know the dose?
I don't.
Okay. And how do you take it every day?
Yes.
Okay. Once a day or
Probably twice a day.
twice a day? Okay. And that's helpful?
Yes.
Okay. And how would you, and you have this pain all the time, every
Yes.
day? Is it worse in the morning, worse at night?
Mornings and nights.
Mornings and
Yeah.
nights? Okay. And you said the hydrocodone helps the pain.
Yes.
Anything else?
No.
No. And the pain's everywhere?
Yes.
Okay. And does it impact your life a great deal?
Somewhat. Slows me down.
On a scale of 0 to 10, 0 being no pain and 10 being the worst pain imaginable, how would you describe your typical joint pain?
7 or 8.
7 or 8. Okay. How about blood? Any anemia or bruising?
No.
Headaches, trauma, dizziness, passing out, seizures, or memory problems?
No.
How about ears? Any deafness, ringing in your ears, ear
No.
discharge, ear pain?
No.
Nasal discharge, nasal blockages, or bloody noses?
No.
How about mouth? Sore mouth, gum bleeding, tooth problems, jaw pain?
No.
Abnormal tastes?
No.
Any throat, sore throat, hoarseness, voice changes,
No.
upper respiratory infections?
No.
How about neck swelling or stiffness? Any goiters or swollen tonsils or anything?
No.
Okay. So just some neck stiffness with the arthritis, but
Yes.
nothing else. Okay. How about your breasts? Any lumps, pain, discharge? No?
No.
Okay. Any excessive thirst, dry mouth?
No.
Any energy or fatigue problems? No. How about breathing? Any shortness of breath?
No.
Do you have trouble lying flat?
No.
No. How about any chest pain?
No.
Chronic cough?
No.
You cough up blood?
No.
Night sweats?
No.
Did you ever have tuberculosis?
No.
How about pneumonia?
No.
No?
Yes.
Yes. Okay. When did you have pneumonia?
Oh, a couple of years ago.
Okay. Any chest pain, heart palpitations, pain
No.
with your legs with moving,
No.
swelling,
No.
ascites?
No.
Cold feet?
No.
Any like inflamed, like
No.
redness? Okay. Any appetite changes?
No.
Weight loss or gain?
Little bit of gain.
Little bit of gain. Trouble swallowing?
No.
Nausea, vomiting?
No.
Bloody stools?
No.
Blood from your rectum?
No.
Any hemorrhoids?
No.
Rectal pain?
No.
Hernias?
No.
How about trouble urinating?
No.
Ever urinate blood or
No.
pus? Incontinence?
No.
Painful kidney stones, passing stones?
No.
Did you ever have pyelonephritis?
No.
And you already said no to STDs?
Yes.
Okay. We talked about your arthritis, your joint stiffness and swelling. Did you ever have gout?
No.
No. Any motor weakness, paralysis?
No.
Seizures?
No.
Trouble with your coordination?
No.
Any sensory, like numbness and tingling, or areas of your body that you can't feel?
No.
How about mental status? You having trouble with your moods,
No.
or any delusions,
No.
hallucinations,
No.
trouble in your relationships?
No.
How about depression?
No.
Did you ever have any suicidal thoughts or
No.
plans? No. Okay, well, Fran, thank you so much for participating today.
Again, my pleasure.
Do you have any other questions for me?
No.
Okay, thank you so much.